If we do see a lameness, one thing I always try to do is to grade the lameness. And this is something that I would highly recommend that you do in your practice. It doesn't matter if your grading scheme is different to my grading scheme, but it probably does matter if your grading scheme is different to other doctors in your practice. So we at our hospital decided that this would be the grading scheme that we were going to utilize. And so that way, when my colleague says that they saw this dog last week and it had a grade 3 out of 5 hind limb lameness, I can tell or know some idea of, okay, well, I'm actually seeing, this the same or a different grade of lameness. And it helps me, especially for those rechecks when I'm trying to glean, are we truly seeing improvement or not? The other thing that we'll want to do with our dogs with hind limb lameness is to actually ask them to sit. And we want to ask them to sit instead of forcing their hind end down into a sitting position, because what I'm looking for is how do they weight shift when they go to sit, and do they sit squarely or do they not sit squarely? So let's look at a video example. So here we're going to ask this patient to sit. Now, as it sat, you may notice that it weight shifted its weight away from the right hind leg. And then once it sat, it isn't sitting very squarely with that right hind. It's actually kicking that right hind leg out to the side. So that tells me that this dog has got an abnormal or positive sit test on the right hind. And that is actually a very useful localizer, which I'll talk about in a little while. I'm going to give you a couple more examples. This patient here, you may notice, is quite weight shifted forward, has quite the low head carriage. And as we ask it to sit, notice how it weight shifts forward and then does not sit evenly on either hind limb. So this dog is a classic example of a dog that has a bilateral hind leg lameness, weight shifted forward, and does not sit squarely. This is another example of a dog with bilateral hind limb lameness. We're asking it to sit. Notice how much it weight shifts forward, and it does not really want to sit squarely at all, okay? Sometimes these dogs get confused with having neurologic problems. So this is actually a dog that has bilateral orthopedic disease, and yet it's having a very hard time getting up, and probably also has a similar sit as the last two dogs because it has bilateral cranial cruciate ligament disease. Oftentimes confused for having neurologic problems. So those examples, these last three dogs that had the positive sit test, these are all examples of dogs that have got bilateral or unilateral cranial cruciate ligament disease. The dog that had the unilateral right-sided sit test, that was a right-sided cruciate tear. The other dogs that I showed were bilateral cranial cruciate ligament tears. Why do they do the positive sit test? They are trying not to fully flex at the stifle joint, or it hurts them to fully flex at the stifle joint. And that's why they weight shift away from that leg when they go to sit. And when they go to sit, they're not going to sit squarely, because to sit squarely, it does require them to fully flex at the stifle. Now, I will say dogs with disease in their tarsus or hock will also have a positive sit test. So to me, the sit test is a nice localizer for hind limb disease, either localizing to the stifle or the hock. What's going to be the more common? Far more common to see cranial cruciate ligament disease. So that's kind of what I'm thinking until I start to do my hands-on exam to confirm my suspicions.